Okay, so for this portion of our class, we're going to talk about the cardiac system, and we're going to go over some initial concepts and then dive into the ideas of heart failure and circulatory shock. The first thing that you need to do is review your anatomy and physiology. Think back to the normal components of the heart and how the heart beats. All right, we need to look at how our blood flow normally goes through the heart. So we have our superior vena cava that comes in our right atrium. It then pumps blood to our right ventricle, leaves through the pulmonary artery to get to the lungs, which picks up oxygen, comes back through the pulmonary vein to the left atrium, to the left ventricle, and out through the aorta to the rest of the body. Right. When we're looking at the heart, one of the first concepts we need to look at is cardiac output. Cardiac output has a direct correlation to our blood pressure and how well we can get blood through the heart into the rest of our body. Right? The cardiac output is actually a measurement of the amount of blood pumped through the heart in 1 minute. Right? The normal healthy individual should pump about 4 to 8 liters of blood through the heart in each minute. The exact amount varies depending on their height and weight and overall size. So for instance, men are usually on the higher, closer to 8 range. Women, the more petite they are, the closer to the 4 liter range. Right, we measure cardiac output by multiplying stroke volume, which is the amount of blood in each heartbeat that goes through the heart, times heart rate. All right, and that gives us cardiac output. There are different things that impact our stroke volume: preload, afterload, and contractility. Right? These are very important concepts, so you'll have to pay close attention here because students often get them confused. Preload has to do with volume. Right? Anything that has to do with volume, blood volume, fluid volume status, anything that impacts circulating volume in somebody's body impacts preload. Right? It's the amount of blood at the end of diastole that's in the heart and is coming into the heart with each heartbeat. Afterload has to do with vascular resistance. So in other words, when blood leaves the heart, how much pressure or resistance does it have to overcome to get blood out of the heart and into circulation? Anything, for instance, that has to do with blood vessels and blood pressure is related to afterload. Contractility has to do with the strength of each contraction or squeeze of the heart. Right? This has to do with how well the heart can beat or pump. Right? We'll look at these as we apply it to the right and left side of the heart. So preload has to do with volume. Think of it as the amount of water we have in our hose or in our circulatory system. Okay. Low preload is going to be impacted by things like dehydration, hemorrhage, volume loss, right? Anything that gives you a low circulating volume or low blood volume is going to give you a low preload. That means that there's going to be less blood coming into the heart with each heartbeat. High preload means we have too much, right? We're fluid overloaded for some reason. Our volume's too high for the heart to handle and it stresses it. Things like having too much fluid volume, right? A severe systemic edema. These are going to have impacts to increase our preload. Now let's think about afterload. All right, so if we think about afterload, that's the amount of pressure that the heart has to pump blood through. The biggest thing that impacts the amount of pressure the heart has to beat against is the size of a blood vessel. All right, the more narrow our blood vessels are, the more pressure it is to get through that hole or that lumen. All right, for instance, water will flow easier through this funnel because it has a larger lumen than it will through this one because it has a smaller lumen. All right. Low afterload means that our blood vessels are dilated, right? They're opened up. Our blood pressure is low. The heart doesn't have a lot of work to get blood out of it, all right? So it's easier. Things that can make a low afterload are like hypotension, right? Vasodilation, those lower afterload. High afterload is whenever we have a high pressure to overcome. Our blood vessels are constricted. Our blood pressure is high. All right, this makes our afterload high. So things like hypertension, all right, vasoconstriction, they're going to impact afterload. Contractility has to do with how much the heart contracts. Stirling's law just simply says that the bigger the stretch, the bigger contraction. Think about it like a rubber band, right? If you go to shoot a rubber band and you only pull it back a little bit, it doesn't shoot very far. If you pull back the rubber band really far as it will go, it's going to travel a bigger distance. Stirling's law says that the more the heart is stretched, the bigger the contraction afterward as the muscles recoil. Alright, so let's look at some common conditions and their pathophysiology of the cardiac system. The biggest one that we usually see in healthcare is heart failure. Alright, general heart failure is whenever the ability of the heart is impaired. Alright, something is keeping it from being able to pump blood efficiency. We measure it by the ejection fraction. So how much blood is ejected from the ventricles in each heartbeat at diastole. The normal ejection fraction should be above 65%. Things that can impact heart failure can be things like, or cause heart failure, like a myocardial infarction or a heart attack, hypertension, because you're going to increase afterload and make it harder for the heart to beat. It's going to get tired. Cardiomyopathy is whenever the heart gets enlarged and it can't beat very well. All right, you can take a minute and pause the video and also just think about other disorders that can lead to heart failure. You might even know somebody, either a friend or family member, who has struggled with heart failure of some kind in the past, and think about the types of disorders that can lead to it. The more common type of heart failure is ventricular failure. Alright, and of that we have systolic and diastolic. Systolic failure is the most common of the two. It's where something is impairing the ventricles from being able to eject the blood out of them. Right? It's a hallmark sign when the ejection fraction goes down that we have systolic ventricular heart failure. Right? You can also see it related to people who've had heart attacks, especially if the muscle of the ventricles has been damaged, if they have long-term increased afterload like hypertension, cardiomyopathy, or if they have faulty valves in their heart with valvular disease. Diastolic failure is whenever there's impaired filling of the ventricles during relaxation. So then the heart doesn't stretch to increase the size of the muscle to get a good contraction afterwards. That's Stirling's law. Right, over time, the walls of the muscle and the ventricles are going to start to get thickened, and the chamber itself will get smaller, so we'll have less blood volume in there to pump blood out. This results then in a decreased stroke volume and a decreased cardiac output because they're not ejecting as much blood as they should. We look at heart failure in terms of which side of the heart is most impacted. Alright, so we have left-sided heart failure and right-sided heart failure. And left-sided heart failure, we mean that blood is backing up in the left ventricles and the left atria. And if those aren't pumping, then blood will keep backing up into the lungs, particularly the pulmonary vasculature, and that gives us pulmonary symptoms. Alright, this is our most common type of heart failure that we see related to hypertension. Alright, so all the symptoms we see with left-sided heart failure are related to the lungs because the blood can't get out of the left side of the heart. It has nowhere to go, so it backs up there. Alright, so we see things like pulmonary congestion, pulmonary edema. They'll often have a cough that they might even have pink frothy sputum in it. Right-sided heart failure is when we have failure of the right atria and right ventricle to pump. Alright, so then blood then pumps or backs up to the body or the circulation. Right, it can't get out of the right side of the heart and continue further, so it backs up. We see symptoms related to our systemic circulation. Alright, you'll see things like jugular vein distension, enlarged liver, hepatomegaly, enlarged spleen, splenomegaly, peripheral edema. Right, oftentimes what has happened for people to get right-sided heart failure, it's because they have left-sided and it hasn't been treated properly, and then it converts to right-sided and cor pulmonale. It can also be caused by somebody has an MI and it impacts their right ventricle. So the right side, think R. Alright, it's going to impact the liver, the peripheral circulation, and the jugular veins. This is just a diagram that can show you which side of the heart failure and how it impacts the rest of the body and the kind of symptoms that it can lead to. Acute pulmonary edema is our most serious side effect of left-sided heart failure. It can be life-threatening. What happens is that since blood is backing up into the lungs, right, the capillary fluid tends to get backed up and pushed into the air sacs or the alveoli. This impairs our gas exchange, right, because we can't have gases come in and get filled up and exchange our CO2 and oxygen, because the alveoli instead get this fluid in them and it makes them stiff. The patients then present with severe shortness of breath, which we call dyspnea. They may even be air hungry, which means they're breathing but they still feel like they're not getting enough oxygen. They can have cyanosis, which is a blue coloring around their lips and in their fingertips that gives the signal that they're not getting enough oxygen. They'll have a pink, frothy sputum. If we listen with our stethoscope to their lung sounds, we can hear that fluid rattling around in there, and we call that rales or crackles. Right, and their oxygen saturation, if we measure that with like the little probes that go on their fingers, it would be low. These are images of complications from right-sided heart failure. So this popping up under the skin, that's the jugular vein. When it's distended, it looks like there's a little snake or a pencil laying under the skin. This would be an example of systemic edema, right, peripheral edema because of the heart failure. And this is comparing a normal liver size, right, to an enlarged liver that has hepatomegaly. To treat heart failure, right, we need to decrease the risk of hypertension, heart attack, and atherosclerosis. This often means we need to do lifestyle changes. They might need to lose weight, exercise more, drink less alcohol, have a healthier diet, get more fiber, all that kind of stuff. They should reduce their salt intake to limit their fluid retention. They may have to limit the amount of fluids they drink each day. They may need to get diuretics, right, to eliminate some extra sodium and water in their circulation. All of our medications are going to be geared at decreasing preload, decreasing afterload, or increasing contractility in order to help their heart to beat more efficiently and to be able to get through circulation. So for instance, if we give them a diuretic, right, or limit their salt to try and reduce their fluids, this is going to increase or impact their preload. Right? If we give them diuretics, we pull off fluid, it makes them pee more, their volume goes down, and we decrease their preload. Right? If we bring down their hypertension, right, this is going to decrease their afterload. Right? We can treat hypertension with lifestyle changes as well as medications, and then they may have to also give them medications to help the heart beat stronger. Alright, we're going to stop here with this video. Next up, you'll pick up with shock.